Great.
I actually came to you at that time with a lot of questions about transitioning from being vegetarian to veganism.
Oh,
The
great.
reason you might not recognize my name is back in the day it was Steph the Cat Lady.
Right. So a lot of people change their names and they change their avatar. They change the little photo. So how would I possibly remember you? Right. But that's great. Okay. So you made the transition from vegetarian to vegan with me. I'm happy to hear that. So
I ended up making the transition, and then I ended up getting very ill from it.
Oh.
So my doctors informed me that I had to go back to being a vegetarian.
So what was the problem? Was it B12 or what went wrong for you?
What happened? I have Crohn's disease.
Ah, okay.
And on top of that, I have a lot of different food allergies, so I cannot really partake in about 70% of the veggies out there. I can't do nuts. I really can't do legumes.
Yep.
So it really
well, I don't know if you know, Crohn's disease. Crohn's disease was a funny turning point on my channel because, Durianrider was selling this myth that veganism would cure Crohn's disease.
It's actually something you and I talked about quite a few times because you remember, you probably don't, but you and I had a conversation where Harley went to Cheetah's stream and I kept saying, hey, I watched your videos and you're the reason I'm trying to transition because totally kissing his ass. And I'm like, you're the reason I'm trying to transition because of all, the wonderful benefits veganism has had on your Crohn's disease.
Right, so you were pretending he really had Crohn's disease. We know he didn't, right? Yeah.
And he's like, yeah, mate, it was wonderful. It did this, and that. And then I called them up. If you had Crohn's, what type did you have? What parts of your body did it affect? All this other shit. What type of medications were you on? And he had no answers for me after that. He just literally shut me down.
And he also never gets the details right about the test he took. He makes up stories. Exactly. But the diagnostic test, he doesn't even know what the diagnostic tests are that are used to establish that you have Crohn's disease. So even that part of his story can't possibly be true. That's right.
Yeah. There's no way in hell on his diet he was ever vegetarian or vegan.
Well, and I just want to put in one footnote here. It is true some people find improvement by having more soluble fiber in their diet with Crohn's disease. But some people, some people, their Crohn's disease gets worse. So I've had several vegans get in touch with me to dispute this, and very often they send me a link to some peer-reviewed paper on this, and I just point out to them, if you actually read the paper, you know what I mean? That's what you're going to find. A certain percentage got better, but some got worse. So Crohn's is a very tricky, very inconsistent condition to treat, and some treatments work for some people some of the time. That's the state we're at with the science. There's a difference between an incurable disease and a disease for which there is no known cure. But Crohn's disease is definitely a case of a disease for which there is no known cure. And in many cases, we don't even understand why people with the disorder respond to their diet in the way they do. Okay.
Well, I can tell you, they say that, the long and short of the answer of what causes Crohn's to kick in is that you might be a genetic carrier for the trait, but there are also always environmental issues that will throw you into a flare. Now,
and I'm sure there's also basically the anti-immune disorder theory that you can treat it by doing things like using bee stings and what have you. So, and again, it sometimes works, but the science doesn't seem to be all the way done that way either.
Put it this way, I am so severe that if you told me shaking a chicken's foot while covered in cooking oil and doing the lambada would help me, I would do it. It's just, I'm one of those patients that at my highest was going between 24 and 27 times a day.
Wow.
I've had over 20 surgeries.
Wow.
I was the one that was in the hospital for a year because I ended up with having 2 emergency surgeries for blockages, and then I was in the ICU in a coma for 2 months. So
I just want to say, I think many people watching this video will be wanting me to state my moral position on this. You're not the only person I've talked to who, for medical reasons, as far as we now understand medical science, has been ordered to go back on a either a meat diet or a vegetarian or a non-vegan diet. I have known people, and I do really sympathize with the position they're in. I think that in the future, I think these are exactly the gray areas of medical knowledge that probably will get ironed out. Like, I think it's very difficult for me to believe that when Crohn's disease is fully understood, that it would be impossible to be vegan and to have Crohn's disease. But that may be 100 years from now. I mean, the scientific progress in this area is not going to be that fast. And, for these people, there are 2 questions. Sorry, I just want to do this really briefly because I know my audience will want me to take some kind of hard moral stand on this. There are people who are making the best decision they can with the available information. There are people who are making a decision that is life or death, and there are people who are making a decision that has terrible impact on their quality of life right now, which is very, very different from someone choosing to eat a hamburger just because they think it tastes good or just because. So I really do sympathize, and I think it it reflects the historical period we're in terms of understanding Crohn's disease.
I also feel that, it depends on person. It depends, just like you said on the case. I did not go back to eating meat. I went back to being, what is it? Pescatarian.
Okay. So you remained kind of a reduced, you tried to be participating as little as possible in factory farms and so on, right?
I participate as little as possible. I try to choose certain foods that, in my mind, ethically aren't harming the animals or killing the animals. So, or I just find substitutes for things. Honey has been a real godsend for me, as turmeric for its healing properties. But with the bees basically going into extinction, I couldn't ethically use honey anymore because I feel like I'm adding to the problem. So I just switched over to agave nectar, which I'm not even sure is better health-wise, but it is a choice that I made.
Well, I just mentioned really briefly, I knew someone who couldn't eat any legumes of any kind, so no beans, no nuts. She had the most extreme form of that, where she would actually have a heart attack if she ate anything like that. And, for those people, even that, so that's a really extreme health condition. She could die on the spot if she ate beans. I still do think there's a moral obligation on them to figure out what is doing the best you can. Because my whole approach to morality is based on doing the best you can. For someone with severe Crohn's disease, the answer is going to be very different, or someone with that kind of really insane allergy. But I really commend you, because it does sound, like eliminating honey and stuff, it does sound like you're making a sincere effort to do the best you can.
I mean, back in the day, and this is going to sound ass backwards, but eating super processed foods were the easiest on my body, because the simple sugars were the easiest for my body to digest. Foods and things like Lunchables and stuff. I lived off that stuff for 2 years, and I was still losing weight. In a year and a half, I went from 300 pounds to 117.
The Lunchables diet, the processed food diet.
And, I would try to, my husband's always been very healthy. I mean, we have a garden now where the ileostomies that I had last year kind of almost reset my system, so that now I am able to increase a lot of the vegetables I wasn't able to eat before. For instance, I've always loved Brussels sprouts, broccoli, and spinach.
Oh, great.
I couldn't look at those without exploding. But in small amounts now, I can eat them and enjoy them.
Great.
So, that itself was good, but again, it's like you say, what causes this? And in my case, I feel like I know what caused my Crohn's. like I said before, my mother, my grandmother, and my brother, and 2 of my cousins all have had some type of gastritis, ulcerative colitis, just different GI problems.
Given, if you don't mind asking,
my brother and myself all had our appendixes rupture between the ages of 12 and 16.
Right. So
and
it seems clear there's some genetic component to it. Have you looked into, or have you experienced, just given that you've already had multiple surgeries, have you looked in or have you experienced the treatments that approach it as an autoimmune disease, such as taking insect eggs, the eggs of worms, or
proteins and stuff like that.
Yeah, or bee sting, wasp sting therapy, and that's has any of that been tried with you or no?
I think I tried. Oh God, which one was it? It was the one where the bug didn't die.
Oh yeah. So they were actually treating you with some kind of parasite to try to get the autoimmune reaction to be directed towards the parasite rather than the body. Yeah. And I take it didn't work, or it didn't work very well.
It didn't work very well, nor did, and again, this being before I was vegan, I was on the biologics, Cimzia, the Humira, the Remicade, not knowing that those were derived from mouse proteins, which now that I know that, I would never go on them again, just because I feel it's kind of disgusting.
Yeah.
And it makes you susceptible to every cold, cough, and rash out there.
Huh.
So it's more a matter of just being hyper vigilant about watching what I eat, making sure that I have a lot of Imodium on hand, and right meds, the right doctors, the right surgeons. But what I wanted to tell you was, I think what screwed me up was that I had always been lactose intolerant, so I always had some diarrhea. But at the age of 16, I started to get very bad cystic acne. My doctors put me on minocycline, which is an antibiotic. I was on that antibiotic for 6 years. For the first 3 years, I was fine, and then I started to develop Crohn-like symptoms. When I went off it at the age of 23, that's when I was diagnosed with Crohn's. And I really think that taking that antibiotic for that long period of time
must impact your digestion, right?
Good flora and bacteria in my intestines, and probably is what propelled me into having a full-blown GI disease.
Well, look, as you know, there's really nothing I can say except I'm sorry to hear that. I mean,
I'm living with it,
Yeah.
I'm not dead, so I'm not dead, but I'm not dead, so.
Yeah. But look, as I say, there is, it's not the case that Crohn's disease is an incurable disease, but right now in 2018, there is genuinely no known cure. And, medical doctors are just human beings. They're not members of a vast conspiracy. They're not. That's also Durianrider's approach, is to vilify the doctors and say that the doctors are secretly trying to keep you down. The doctors, they may not know much more than you as a patient. You've been a patient for so many years and researching it and reading about it because you're suffering with it. But the doctors are human beings coping with very imperfect information. And in this case of Crohn's disease, the same treatment can have totally different outcomes for 2 different patients. And we don't know why. Right. We do not know why. So there's this sense of trying all over the place.
I guess my biggest hurdle whenever I tried to stay out of the ER because I literally did spend all of 2015 in the hospital. Yeah. In 2016, I came home. I fought for 6 months to have my second ileostomy taken down, which they did. Then in September, they found a cantaloupe-sized tumor cyst thing on my right ovary, which they said in the beginning was precancerous, and then after the surgery, when they did more studies on the biopsies, told me that it was super early stage 1. So I've been avoiding the ER for a long time now and just self-regulating with the medications that I know work for me. But
my husband, being the brains of the operation, need to take turmeric. And it's like night and day. All of the money that I've spent on prednisone and biologics and antispasmodics, all these different, meds that give you 10,000 other symptoms, and 2 tablets of turmeric a day have helped with my inflammation.
So look, I'm going to put up this video. I'm not going to edit that out. But I've got to say again, you understand how dangerous this can be on the internet. Because some other person, you said before, you were desperate for any hope. Someone like Durianrider suggesting this. You're someone who, if someone told you to use a magical talisman to cure it. I'm also afraid, you say that, and I put this on my channel, I'm afraid someone else is going to quit all their meds and try turmeric. So, guys, again, keep in mind what I just said. I know, no, I understand. No, it's fine. It's fine, but I just say, again, this is an illness where different treatments have different outcomes for different people, and this is not medical advice, but she's talking about something that worked for her, something that helped alleviate her symptoms. Okay, look, I've got to wrap it up. It's been more than 15 minutes. Thank you for coming on the show. No, it's okay. I mean, I do sympathize. It's a terrible struggle that you're in. I mean, it's a terrible struggle nutritionally. It's a terrible struggle of life and death. But the thing I want to emphasize here is even for someone with a health condition this extreme, where the consequences are so high in terms of your suffering when they're in the ER, this is someone who is still trying to make the effort to do the best that she can.